Hello, Caroline. How are you doing today?
I'm good, thanks, Mike. How are you?
I'm not too bad at all. It's sunny at least today, so it's
I
an
know it's lovely.
improvement.
It's really nice.
Um, yeah, there's a lot to get through today, and I know you've got very, very limited time. But thank you for carving out a little bit of a gap for us. I'm not sure we'll get through all of the questions today, but we'll do our best. And I don't want to delay too much at the start. But before we start, I thought this was quite important, and I'm not sure you'll even want me to mention this, but I think it's important we give credit where credit's due. So I wanted to acknowledge the work that you and others have done to make sure that the just announced national 5p uplift in staff fuel mileage expenses happened. I know we talked last time that that was something that you were pushing for nationally with other chief executives, and that was after it was raised in the Q&A by a number of people. I guess that just shows some of the value in the Q&A, and I just wondered if you wanted to reflect on how that kind of feedback that we get through this type of forum and through the visits that you do, how that shapes what you do as chief executive.
Yeah, Mike, happy to do that. So I can't take any of the credit for the decision that was made. And I think I spoke that was going through STAC and other national groups. But what this and as you say, when I speak with colleagues every week when I'm out and about, in fact, most days, it allows me to just understand what's worrying people, what's frustrating people. And so that one, for example, actually it did take a national conversation to resolve. And so through these processes, I'm able to then go into those conversations and influence. I have to say it didn't take much influencing. There was a real desire to do the right thing in Scotland, and our partnership colleagues were all over it. So what it allows me to do is to, when I am in particular forums, to influence and if needed, negotiate different positions. Without that, it's very difficult. Without these, it's very difficult for me to know quickly enough what's on people's minds. And I think this is one way to do it through the Q&As, but also one of the things that I am really conscious of is how do we create the conditions for colleagues, managers, leaders at a local level to resolve problems that they know are really frustrating their teams and getting in the way of what makes a good day's work. And so really creating the conditions, empowering colleagues to be able to resolve that rather than those becoming big frustrations that grow into huge issues and build up resentment and frustration. So yeah, this is one way of doing it, and I'm pleased that that's resolved. And I think it's really important for me to know what's going on for people across the system. So yeah, it's one of a number of things we need to do.
Thank you, Caroline. And I know just before we jump immediately into the new questions, there were maybe a couple of follow-ups from previously asked ones. I think you'd got some more details for people. I think one of them was you mentioned about the Australian nurses, the number of those people that are still working with us. Have you got a figure for that, I think?
Yeah, I don't think I had that. I had a number of figures in my mind the last time, but so I've confirmed that it's 31 colleagues remain with us from Australia, which is great. And there's another 27 on their way over. So really looking forward to meeting them, as I know colleagues watching this will be. And then, as I said in the last, when I was asked this question, Australia, we're looking beyond Australia as well now, and I think I mentioned colleagues coming from Nigeria, which is exciting. So yeah, that's my answer to that. I'm going to try and be really succinct so that we get through the questions, which, as you know, I like to chat, so it'll be a challenge, but I'll do my best.
Okay. And I think the only other one, the outstanding ones, was from Dr. Matthew Newman, who asked about when work experience placements might start again.
Yes, yeah, really good question. And I think I said at the time, really important. So Jerry Laurie has confirmed that they are just understanding that services can accommodate that now, and that will definitely be started up as soon as possible. And I think, Mike, she shared in an email address for people to submit their applications for notes of interest for those that wanted work experience. We could put that in the brief, maybe.
Yeah, absolutely. That would be fine. And I'll share it on screen just now as well. So
Okay.
So yeah, thank you for those updates. And I just wanted to say that the Q&A and the number of questions that we get are bigger than we ever thought. And there's a fair bit of research that goes into trying to find out some of the answers. Myself and one of our colleagues, Kate, are working to try and make sure we get a bit of a system in place and make sure that there's nothing that we missed or could have answered better. So hopefully that'll get a little smoother as we go forward. Okay.
It's all learning.
Indeed, yes. So I'll jump into the first question for this week. It comes from Amanda Copeland, who's a specialist. She says she works with people aged 16 to 26 with a cancer diagnosis, and she's really keen to restart face-to-face peer support for these young people and also to start parent support sessions. She asks if you, Caroline, could advise when she might be able to do that on NHS Grampian premises.
Yeah. So Amanda, gosh, what a job, and the importance of being able to build those relationships for all interactions in health, but I would imagine for the people that you work with, critically important. So I don't know the answer to that. However, I would suggest that the guidance and the restrictions, the constraints that we've had are definitely lifting now, whilst I will acknowledge that pressures don't feel any different for health and care. And we have to make sure, I believe, as an organisation, that we are creating pathways of care that are right for that person, particularly that young adult, and the family that supports them. So really family-centred care in this instance. And I would be advocating really strongly that as the clinician that interfaces with them, you have to make your case for why that is critically important. Now, I understand that a number of colleagues and indeed people, and again, it's interesting, that population, so young adults are really keen to maintain the virtual communication, and so it might be all virtual, it might be a blended approach of in-person and virtual, or indeed there will be people who just want that physical contact. So this is something I would strongly suggest that you, with your clinical colleagues, start to understand with your community of patients what's going to work for them, and then move that forward. I hope that's the approach we're going to take with all patients and pathways. So from an infection prevention control perspective, we are definitely moving back to the standard guidance, and I'm sure there will be some physical spacing things, but if speak to your nurse manager, your senior charge nurse within your team, and make the decision based on what's right for those young adults.
Thanks, Caroline. I think a lot of people will be pleased to hear that type of answer rather than relying on blanket policies. It's based on what's needed in the local area. So, okay, the next question is an anonymous one. They mentioned that in episode 6 of the Q&A, there was mention of reviewing the roles of healthcare support workers. They say they welcome that and it's good news. They've asked if there are any plans as part of the work that's being done to look at what healthcare support workers on band 2 and 3 can actually do. The colleague gives a few examples. For example, in the community, help at home care staff can administer medication, including controlled medication sometimes. But in a hospital, you need to be a band 5 and have a degree to give medication. Is there anything that you could say to that one, Caroline?
Yeah. So that is the entire point, is that by the opportunity to look at the career pathway for healthcare support workers who work at level 2, level 3, level 4, aligned to Agenda for Change pay grade level 2, 3 and 4. You will note I try really hard not to refer to colleagues by their pay grade. That's intentional, because I think it's interesting that we choose to do that. So the whole point is to make sure that we are using the skills and attributes and knowledge of colleagues in these roles to contribute most effectively to patient care, wherever that is. Now, there's an interesting thing about colleagues who work in social care in similar roles, and they are regulated by the SSSC, which is different to healthcare support workers who work in the NHS. And June Brown, our nurse director, is working with colleagues across the system to understand what are the different skills and knowledge and competencies of each of these roles. And medicines administration is a complex one. Gosh, look at where we've been with vaccinations. So I think that I am assured that this process will mean that, firstly, healthcare support workers are absolutely involved in designing this. It will create differences of levels of practice for those particularly those three. And I'm not going to say whether or not that will what that will look like. That will be the process that June undertakes through the processes that she'll outline, and she can maybe do a bit on that, Mike, in the brief. So it's really important, and I know it's part of this year's work for June and the team to progress that. Medicines administration is, it's much more than just giving somebody medicine, and actually the degree that you reference for regulated nurses who do start their career at a band 5, there's much more involved than just the administration of medicines in that process. And so I think there's a lot of work to be done around it, but it absolutely is the opportunity we've been waiting for to really recognise the contribution that healthcare support workers make.
Okay, I think the next one hopefully is an easy one. It's about the Queen's Platinum Jubilee, which we've been asked about before. An anonymous colleague has asked if you can confirm whether enhanced rates of pay will be available that day, like they would for other public holidays.
Yes, and hopefully by the time you see this, it'll have been in the brief, but yeah, it will just be the same as any other public holiday.
There we go. I think that's the quickest answer we've ever done. There we are. Straightforward. Okay, there's another question here from another anonymous colleague. They say they've requested to work from home for 1 to 2 days a week, but unfortunately they've been told there are no laptops available. She states that she's been told there's only a small fraction of the laptops required for the number of staff who need or want to work from home. Is that something that you're aware of, and is there anything that you can say about that?
So so I'll start a bit bigger than that. So a bit bigger than that is what I'm trying to understand is, what does the future of working look like for those that can do some elements of their role at home, and again, a bit like the answer to the pathways thing, I am determined that we start to make decisions about people, not as big blanket decisions. So I think that we're working our way through that, and are looking at how we can have, I'll say, hybrid ways of working, but it's not very glamorous, but really thinking about because there are benefits to working from home, but there are also downsides to it, and it suits some people, but it doesn't suit others. So how do you manage that with the thousands of colleagues that we have in our system? And I recognise that there's a large number of our colleagues have to be present to actually do their job. So it's really important that we don't create silos in the workforce in that way. So having said all of that, IT kit should not get in the way. It should be, the decision making should be about, and that's a lot of shoulds in there, which obviously means I know that it's not right. So the decision should be based around, is this right for the person and is this right for the service? And if that is a yes and a yes, then we have to provide the kit that is required. So that is my answer to that. And however, I do know that sometimes it feels as if it's slow to get kit, or doesn't feel, it is slow to get kit. And Paul Allen and the team around supply. I mean, if you think of the demand on our IT colleagues over the past 2 years, the level of support, I certainly know when I've got stuck, and I don't think it's just because I'm the chief exec, because I try not to disclose that when I use the helplines or anything like that. They've just remained so kind and so helpful despite the demand. So they have tried really hard to ensure we've got the right kit. I am sure Paul recently quoted to me that there were as many laptops in the organisation now as there were colleagues. So thousands and thousands. I think I'm right in saying that, but I'm sure he'll tell me if I'm wrong. So if you need a laptop to do what you want to do, and that's right for you and right for the service, then just make sure you've followed the due process. And it will take a little bit of time, but it will be resolved. There won't be a you can't get a laptop, because if you're going to work from home, you need the kit. So yeah, if you do that, and if you come up against any more problems, then just go through the normal channels to get that kit. But yeah, IT kit should not stop people from having the option to work from home as long as it's right for them and the service.
Thank you, Caroline. The next one is from one of our nursing colleagues in Aberdeenshire. She asks if you think NHS Grampian is a family-friendly organisation. She points out that a huge percentage of the workforce are females who may at some point be working mothers. And she asks, how do you see that 12-hour shift patterns work for those people? And she also asks whether you'd be surprised to know that sometimes parents are denied the hours they require to return to work after maternity leave.
Gosh, there's quite a few questions in there, isn't there? Right, so I'll try and go through them, but tell me if I miss one. So, do I think NHS Grampian is a family-friendly organisation? I think that the National Health Service and NHS Grampian are pretty family-friendly. I think that our policies absolutely support flexible working and the opportunity. I mean, our T's and C's around carers leave, around paternity leave, in comparison to lots of other employing organisations, I think is reasonably good. Do I think that it meets the needs of every set of parents or those that have caring responsibilities and other family demands? I think it's really difficult to do that, isn't it, for such a broad organisation? So I think the principles are family friendly. Our policies aim to be family friendly. Sometimes how that's implemented can feel as if it's not, and I understand that. I can understand that from having worked in the NHS for 30 years, having 4 kids of my own during that career, and being very clear about what I needed, but actually not so sure the organisations I worked in thought that's what they needed. So yeah, it's not always going to meet everybody's needs, but it's really hard that we keep trying to do that. And I'll just link that to the last bit of the question. I think sometimes people come to things with different views. So if you're coming to, and I'm not going to specifically speak about women, I agree they are the largest part of our workforce, but actually I welcome and and the joint parenting from both, and it's not just about kids, it's obviously the caring responsibilities for other members of the family as well that we're trying really hard to support. So I think it's sometimes difficult when you're looking through it through your lens as a parent or as a carer, and when whoever you're negotiating that or working that through, so your line manager, is thinking, oh my goodness, how am I going to get these rosters to work? How am I going to provide care to these patients? So two people come from different perspectives, and there is no single truth really, is there? It's just different views. So I would always encourage when that happens is just to say, to pause when you feel as if you're getting into that conflict, and just see who's around to try and help us with some advice. And the HR hub, I know, takes regular calls about, this is what I want to do, but I'm really worried about this, between managers and colleagues, and they help them to work through a solution to that. So that's a suggestion on that. 12-hour shifts. So a personal view on 12-hour shifts is that I don't think they're great for a work-life balance. But what I have learned through many mistakes is lots of other people have different opinions, and we have to create the flexibility in NHS Grampian to have either traditional shifts or 12-hour shifts, or a mixture of both. I think I am way too long in the tooth to be naive enough to say one size fits all. So it's about that flexibility around what works for people.
I don't know if you've got time to squeeze one more in.
Yep, that's fine.
Okay, this one is from Marie Rennie. She asks why it's so difficult to transfer from a vaccinator post to the bank. She talks about how many people have worked tirelessly as vaccinators, and when the contract's finished at the end of March 22, they were offered positions on the nursing and midwifery bank, but they've had to reapply to make that happen. And she feels that there's far too many people being lost to the NHS at a time when the skills are actually required.
I have no idea why it's so difficult. It shouldn't be, and I'm sorry that you're having that experience. My suggestion, before I demonstrate my exasperation, is that we just get in touch. If Anne-Marie can get in touch with Colin McNulty, and just find out what the issue is that's getting in the way of that. I would have hoped we could have found a straightforward way to transfer contracts. And if not, then there's maybe some learning in it for us that we need to think about. How do we make this really easy? Undoubtedly, Mike, that will not be as straightforward as I've suggested, but let's understand the problem. So if we make sure we have a conversation with Colin to understand what the issue is. And I think Mike might have frozen. So I'm just going to say goodbye to everybody on this Q&A, so I don't have to re-record it, and you all have the pleasure of looking at Mike frozen on the screen, and we will be back soon with another Q&A. Thank you.